So patients always have so many questions about compression garments. So let's break it down. What is a compression garment? How long do you wear it? What is the importance of it? Hi, everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I am Dr. Ashley Amalfi. I'm a board-certified plastic surgeon in Rochester, New York, and I'm joined with my dear friend, Dr. Smita in New Jersey. Hi, girl.
Hello. Hi.
Last topic in our favorite series ever, right?
Yes, favorite series, all about liposuction. We are answering all of the questions, debunking myths left and right. This is the last one. You don't want to miss it.
Yeah, absolutely. So, this is one that I think people are so confused about because there's so much stuff out there on the internet and influencers telling about their liposuction journey. And so patients always have so many questions about compression garments. So let's break it down. What is a compression garment? How long do you wear it? What is the importance of it? So get it started, girly.
Yeah. I mean, so I think, listen, the first thing is, right, every plastic surgeon will recommend a compression garment. Now, if you're talking about the nitty gritty of the type of compression garment and how long their protocol is and whether you're incorporating foam pad, all this other stuff, that's very surgeon specific. So what we do in our practice, it may not be exactly what your surgeon recommends, but they will recommend compression. That's the most important, is just some sort of compression. The details of that might vary a little bit practice and surgeon to surgeon. But essentially, I think first of all, the reason why we recommend compression is because with liposuction, take out all the fat. Our body likes to fill up every space with fluid. This is why we typically leave drains with tummy tucks and neck lifts, things like that. But with liposuction, there isn't this big pocket to put in a drain. Most of us don't leave drains for liposuction because compression will sort of hold that space together and make it tight so that there isn't space for that fluid to build up. But additionally, you just swell, right? Like that's part of the fluid building up. And so by adding the compression, you're minimizing that and sort of helping that swelling to go away faster so that you can truly get to your real results when the skin starts shrinking. So that's why we recommend compression. The duration of that, at least for me, I typically, and I know you're sort of the same, right, Ash? But for me, I sort of tell patients, listen, 6 weeks after surgery, you're going to be wearing compression garments that are provided to you by us. And just wear it 24 hours a day, right? Like take it off to shower, obviously. If you need to wash it, take it off. If you need a break, by all means, take a break. But you should be wearing it 21 hours a day at least, especially for those first 6 weeks where you're going to be the most swollen. And that's sort of the critical time where you want to do everything that you can to maximize your results, and compression is one of them.
And I think a lot of people ask how tight it should be. I mean, I think people just have different tolerance for that. Obviously the tighter it is, the more it's going to prevent that swelling and the fluid buildup, but also you got to be able to breathe. So you don't want to be constricting yourself, or I see some people wear things that are too tight and it can create a crease or an indent or things like that. So you want to be careful of that, make sure that it's smooth. But also that it's tolerable, because the most important thing is that you wear it. If you buy this thing that's way too tight, or you find this one that you want to buy on Amazon and you get it and you can't even breathe in it, so you don't wear it, then that's useless. You want something that you're consistent with so that it can do, just like Smita was saying, it can kind of squish things down, right?
Right. And it'll change too, right? As you start to lose the swelling, it'll be too big for you and you downsize. Yeah. So save those smaller ones, shrinking. But I mean, I think you brought up a good point too, because the creases are really sort of the bane of my existence, right? Especially if you are just putting constant pressure in one area where we've done liposuction, so it's already swollen, those creases can become permanent. To the point where we're sort of stuck. It scars. So in any garment, whether it's, what we give you, what you buy on Amazon, if you want a second, I always tell people, listen, put it on for like an hour, take it off, see where those creases are in your skin and see if it's starting to cause indents. And if it does, then you need to do something about it. Like watch how you're sitting. Don't because a lot of people get that crease along the stomach just because of like that's where your fold is when you're sitting. So things like that you just have to be more cognizant of when you're wearing your compression.
Yeah, I think that's super good advice. The other thing I find is like at first people are like, oh my gosh, how long do I have to wear this? And they want to know like the day that they can take it off. And then they realize that it actually makes them feel better, right? And then they don't want to take it. Then they're scared to like detach from their compression. They love it.
Right. Like 6 months later, they're still like, oh, I wear it every day. And you're like, you can take a little bit of a break. Like, it's okay.
Yeah. I mean, but it actually, it helps with some of the recovery symptoms too. Because when those liposuction areas are shaking around when you're moving or working out or just getting back to normal, it hurts. And so the compression keeps things kind of compact. So things aren't as wiggly and jiggly. And it actually feels better during the recovery. So people learn to love it. They feel like self-conscious without it because they're used to the security of that compression, which is great. I love it when they love it.
Which is good. I mean, it's just that extra support that you need to just keep things tight while you're recovering. The other thing is too, it's like the creases, but then also, sorry, I'm going back to the creases again because I just thought about
it's a pet peeve.
zippers.
Yeah, zippers is the same.
Obviously.
Yeah.
But zipper is the same thing, right? Like compression garments. Listen, I had a patient's husband like cut one off of her because it was so tight they couldn't get it off. So it's uncomfortable. So people are like bracing the walls like as they're trying to get this on. And so you want to choose zippers, right? You want to choose zippers or clasps so you can get it on it, which is fine. But again, look at the seams. Just make sure it's not like on an area where we've done liposuction or it's too tight on that area.
Yeah, they might
we can continue with the rest. I'm done with my
spiel. You're done with your seam obsession. Yeah, like it might be easier to have those zippers and snaps and stuff in the beginning, and then you might be able to pull something on and off a little bit easier when you're back to normal activity. And then, and then you guys are in charge. You become the experts of your own swelling, right? So then I have patients who then decide, months later, your swelling is still resolving and they may have a really busy day when they're on their feet and they do feel a little swollen at the end of the day. And I love it when patients know their own body and they're like, yeah, on a day like that, I might actually put it on and wear it to bed. Or if I know I'm going to have this crazy day, I might randomly wear it on, Wednesdays because they're busy, long hour shifts or something like that. So you guys then become the experts of your own swelling. You know your body, when you feel puffy or swollen. I mean, we know it. And so we love when you guys kind of take that freedom and keep doing that because that continued therapy is awesome.
Yeah. I mean, that's the thing. Like after those 6 weeks or 2 months, the more you wear it, the better, right? Like it's definitely not going to hurt you. And so, like I said, some days you might wear it longer than the other just because you know your body. But it is definitely necessary to get to the best results that you can have. So we love compression. It's a good thing.
Absolutely. So wear your compression. We don't care what brand, as long as it fits, it doesn't cause an indent, and you're wearing it. That's the most important thing.
You need to just wear it. Exactly.
Yep. It's your best friend after liposuction. So thank you guys so much for tuning in. Liposuction has been so much fun. We've debunked so many myths, given you hopefully really good ideas and an idea of what's in store for your liposuction procedure.
Yes, absolutely. Well, make sure you guys subscribe. Lipstick and Lipo, YouTube, and Spotify. And we'll see you next week with a brand new episode.
See you there, guys. Take care.
Bye.